Hypnosis is a state of heightened focus and suggestibility that allows the brain to operate in a different mode of attention, distinct from ordinary waking consciousness. In this state, neural circuits associated with focus, awareness, and emotional regulation are more active, while networks responsible for mind-wandering or habitual thought patterns are down-regulated. This creates a mental environment where external suggestions or internally guided intentions can be received more efficiently and integrated more deeply into neural pathways. Unlike sleep or unconsciousness, hypnosis requires full awareness and engagement, but the mind is more receptive to influence because cognitive filters that normally limit attention or resist change are relaxed. This unique combination of focus and receptivity is what makes hypnosis particularly powerful for enhancing both mental and physical outcomes. At the neural level, hypnosis affects brain regions involved in attention and executive control. Functional imaging studies have shown that during hypnosis, areas such as the anterior cingulate cortex, prefrontal cortex, and parietal regions show altered activity. These regions are critical for sustaining attention, monitoring internal and external stimuli, and selectively focusing on relevant information. By modulating activity in these areas, hypnosis allows individuals to direct their mental resources towards specific goals, thoughts, or visualizations with greater intensity. This deepened focus can enhance learning, skill acquisition, and memory retention, as the brain is more capable of forming strong and lasting neural connections when attention is concentrated. Another key feature of this state is increased suggestibility, which refers to the brain's heightened responsiveness to ideas, instructions, or imagery. When suggestions are delivered during hypnosis, whether by a practitioner or through self-hypnosis techniques, the brain is more likely to accept and integrate these messages without the interference of critical or habitual cognitive resistance. This does not mean that the mind loses control. Rather, it operates with enhanced plasticity, allowing new patterns of thought, emotion, and behavior to be established more efficiently. For instance, visualization exercises performed during hypnosis can reinforce neural pathways related to desired behaviors or mental states, creating measurable changes in perception, performance, or motivation. Hypnosis also leverages the natural interaction between attention and bodily function. When focus is intentionally directed toward specific sensations, movements, or physiological processes, the nervous system can be guided to optimize outcomes. Athletes, for example, use hypnosis to visualize precise motor sequences, which strengthens the corresponding neural circuits and can improve actual physical performance. Similarly, focusing attention on relaxation, pain modulation, or immune function can influence autonomic and hormonal pathways, supporting mental and physical health. The state of deep attention reduces competing mental noise, allowing these processes to operate more efficiently. The combination of concentrated attention and heightened receptivity also promotes emotional regulation. By focusing on calming imagery or positive suggestions, individuals can downregulate stress responses and enhance feelings of control and confidence. This can create a cascading effect in which reduced emotional reactivity improves cognitive clarity, decision-making, and resilience, further enhancing the benefits of hypnosis. By consistently practicing hypnosis or guided focus exercises, individuals train their brain to enter this heightened state more readily, allowing them to direct attention, integrate suggestions, and influence both mental and physical systems with greater precision. Over time, this capacity for focused receptivity strengthens cognitive control, accelerates learning, and provides a foundation for improved mental and physical performance. Hypnosis has a profound effect on the body's stress regulation systems because it can shift the balance of the autonomic nervous system. Under normal circumstances, stress triggers sympathetic nervous system activity, commonly referred to as the fight-or-flight response. This activation increases heart rate, elevates blood pressure, releases stress hormones such as cortisol and adrenaline, and primes the body for rapid action. While this response is essential in acute situations, chronic activation of the sympathetic system contributes to fatigue, inflammation, impaired immune function, and numerous physical and mental health issues. Hypnosis, by contrast, engages the parasympathetic nervous system, promoting relaxation, reducing physiological arousal, and allowing the body to recover from stress more effectively. During hypnotic states, neural networks that regulate attention, expectation, and emotion are modulated in a way that downregulates sympathetic activity. Functional imaging studies have shown that hypnosis can decrease activation in the amygdala, a key region involved in processing threat and fear responses while enhancing prefrontal cortex control over emotional regulation. This results in a measurable reduction in perceived stress, improved mood, and greater resilience to stressful stimuli. By deliberately entering a hypnotic state, individuals can learn to control their physiological stress responses, creating a feedback loop in which mental calm promotes physical relaxation and vice versa. Hypnosis also affects the endocrine system, particularly the hypothalamic pituitary adrenal (HPA) axis, which governs cortisol release. High cortisol levels over time can impair immune function, increase inflammation, and disrupt metabolic processes. Through repeated engagement of hypnotic techniques, cortisol levels can be modulated more effectively, supporting improved immune response, better metabolic regulation, and reduced inflammation. Individuals practicing hypnosis consistently report feeling calmer, more in control, and less overwhelmed by daily challenges, reflecting both subjective and physiological changes in stress regulation. Another important mechanism involves heart rate variability, HRV, a metric of autonomic nervous system balance. Higher HRV indicates a strong parasympathetic response and better adaptability to stress, while lower HRV is associated with chronic stress, anxiety, and fatigue. Hypnosis has been shown to increase HRV by promoting parasympathetic dominance, allowing the heart and vascular system to operate in a more efficient, restorative mode. This physiological shift not only enhances immediate relaxation, but also contributes to long-term cardiovascular health, resilience, and overall vitality. Hypnosis can be used proactively or reactively to manage stress. In proactive applications, it serves as a daily practice to train the nervous system to respond less intensely to stressors, essentially recalibrating baseline stress sensitivity. In reactive scenarios, it allows individuals to quickly downregulate stress in response to acute challenges, providing tools to recover from high-pressure situations without long-lasting physiological consequences. Combining focused attention, visualization, and guided suggestions, hypnosis enables precise control over the mind-body connection, promoting both immediate relief and durable improvements in stress regulation. By regularly engaging in hypnosis, individuals can create a resilient physiological and psychological framework for handling stress. The combination of parasympathetic activation, cortisol modulation, and improved emotional control allows the body to maintain balance even in challenging environments. Over time, this consistent practice fosters greater emotional stability, reduced anxiety, improved sleep quality, and enhanced overall mental and physical health. Hypnosis is a highly effective tool for managing and modulating the perception of pain, providing both mental and physiological benefits without relying on pharmaceutical interventions. Pain is not simply a direct sensory signal. It is a complex experience shaped by attention, expectation, emotion, and neural processing. Hypnosis works by influencing these pathways, allowing the brain to reinterpret or attenuate the intensity of pain signals. During hypnotic states, focused attention and heightened suggestibility enable individuals to redirect cognitive resources, alter neural processing, and reduce the subjective experience of discomfort, effectively decoupling the sensation of pain from emotional distress. Neuroimaging studies provide insight into the mechanisms by which hypnosis modulates pain. Regions such as the anterior cingulate cortex, somatosensory cortex, insula, and thalamus, areas responsible for processing nociceptive signals, show decreased activity during hypnotic analgesia. Simultaneously, higher-order regions in the prefrontal cortex, which govern attention, expectation, and cognitive control, show increased engagement. This combination allows individuals to reinterpret sensory input, diminish the emotional impact of pain, and maintain functional control over their responses. Essentially, hypnosis strengthens top-down modulation of pain, giving the brain the ability to dampen distressing sensations while preserving awareness and control. One of the most powerful aspects of hypnosis for pain management is its versatility. Acute pain, such as that experienced during medical procedures, can be attenuated through guided hypnotic imagery, focused attention, and suggestion. Patients who engage in hypnosis often report reduced discomfort, lower anxiety, and decreased reliance on anesthesia or analgesics. For chronic pain conditions, including back pain, migraines, and fibromyalgia, repeated hypnotic practice can retrain neural circuits, improve coping strategies, and reduce the long-term impact of persistent pain. By altering how the brain perceives and responds to nociceptive signals, hypnosis addresses both the sensory and emotional dimensions of pain, Hypnosis also interacts with the autonomic nervous system to influence pain perception. By enhancing parasympathetic activity and reducing sympathetic arousal, the body's inflammatory and stress responses are moderated. Chronic stress can amplify pain sensitivity and exacerbate discomfort through elevated cortisol levels, muscle tension, and heightened neural responsiveness. Hypnosis mitigates these factors by promoting relaxation and creating a physiological environment that supports pain tolerance, recovery, and tissue repair. This dual effect, modulating perception and improving bodily conditions, makes hypnosis a uniquely holistic approach to pain management. Visualization and mental rehearsal during hypnosis further amplify its benefits. Individuals can imagine cooling, soothing, or numbing sensations in the affected area, or visualize the body healing at a cellular level. These mental exercises reinforce top-down neural control, enhance focus away from pain, and promote adaptive coping mechanisms. In addition, the repeated use of hypnotic techniques strengthens the brain's capacity for self-regulation, enabling individuals to respond more effectively to discomfort outside of formal sessions. By training attention, perception, and physiological response, hypnosis empowers individuals to manage pain in ways that complement traditional medical treatments. The integration of focused awareness, suggestion, and autonomic regulation creates a powerful system for reducing discomfort, improving recovery, and enhancing overall well-being. Over time, this practice not only diminishes the subjective experience of pain, but also promotes resilience. A hypnosis is a powerful tool for enhancing cognitive performance and mental focus because it directly modulates neural networks involved in attention, learning, and executive function. In a hypnotic state, the brain's default mode network, which is typically active during mind-wandering or self-referential thought, becomes less dominant. This suppression allows task-positive networks responsible for goal-directed behavior, concentration, and problem-solving to operate more efficiently. By reducing internal distractions and sharpening attentional resources, hypnosis creates a mental environment that is highly conducive to learning, memory consolidation, and creative thinking. This ability to enter a focused state on demand makes hypnosis particularly useful for both mental and physical skill acquisition. During hypnosis, prefrontal cortical regions involved in executive function show heightened activity, while areas associated with distraction or extraneous thought are downregulated. This shift in neural dynamics allows individuals to allocate cognitive resources more effectively, improving the efficiency of decision-making, analysis, and problem-solving. For students, professionals, and athletes, this means the capacity to concentrate on tasks, rehearse complex skills, or engage deeply with material is significantly enhanced. Hypnosis strengthens the brain's ability to sustain attention over longer periods without fatigue, allowing for more productive practice and accelerated learning. Visualization is a central component of hypnosis that contributes to cognitive and performance gains. By mentally rehearsing movements, strategies, or desired outcomes during a hypnotic state, individuals can reinforce the corresponding neural circuits in the brain. This process, known as motor imagery, has been shown to improve skill execution and precision in athletes, musicians, and performers, even without physical practice. The same principles apply to mental skills. Visualizing problem-solving approaches, rehearsing presentations, or imagining effective study techniques strengthens relevant neural pathways, making these skills more accessible and automatic in real-world scenarios. Hypnosis also supports memory retention and learning by facilitating a state of relaxed yet heightened attention. In this state, the brain is more receptive to forming new connections and integrating information. Repetition of focused suggestions or visualizations during hypnosis can solidify memory traces, enhance recall, and improve the efficiency of cognitive processing. This makes hypnosis a valuable tool for exam preparation, skill mastery, or creative problem solving, as it enables the brain to optimize the encoding and retrieval of information while reducing interference from distracting thoughts. Mental flexibility and creativity are further enhanced through hypnotic states because the reduction in habitual thought patterns allows for novel connections to emerge. The brain's capacity for divergent thinking is increased, making it easier to generate original ideas or approaches to complex challenges. By entering a hypnotic state regularly, individuals can strengthen their ability to access creative insights on demand, improving both professional and personal problem-solving capabilities. The combined effects of focused attention, enhanced visualization, memory consolidation, and increased creativity make hypnosis a comprehensive tool for cognitive enhancement. By practicing hypnosis consistently, individuals can train their brain to enter this optimized state more easily, creating long-lasting improvements in mental performance, learning capacity, and task execution. Over time, these benefits accumulate, resulting in sharper focus, greater efficiency, and enhanced cognitive resilience in both everyday and high-performance settings, adaptive coping, and long-term improvements in mental and physical health. Hypnosis is a highly effective method for facilitating behavior change and forming new habits because it leverages the brain's natural capacity for neuroplasticity and suggestibility. In a hypnotic state, the mind is in a heightened state of focus and receptivity, allowing ideas, suggestions, and visualizations to be more easily integrated into neural pathways. This unique state reduces the influence of habitual cognitive resistance and critical thinking that often prevents individuals from adopting new behaviors or breaking old patterns. By bypassing these mental barriers, hypnosis allows individuals to internalize desired behaviors more deeply, making habit formation faster, more consistent, and sustainable. One of the primary mechanisms through which hypnosis facilitates behavior change is the reinforcement of neural circuits associated with specific actions. Repeatedly focusing on a desired behavior or outcome while in a hypnotic state strengthens the synaptic connections that support that behavior. For example, someone attempting to quit smoking can use hypnotic suggestion to visualize themselves rejecting cigarettes, feeling empowered, and experiencing improved health. Over time, these repeated mental rehearsals consolidate the new behavior in the brain, reducing cravings and automatic responses associated with previous habits. Similarly, hypnosis can reinforce positive routines, such as exercising regularly, maintaining healthy eating patterns, or adhering to productive daily schedules by repeatedly aligning conscious intention with subconscious programming. Hypnosis also works by reshaping associations linked to undesired behaviors. Many habits are maintained because the brain has formed strong links between specific triggers and automatic responses. For instance, emotional stress might trigger overeating, or fatigue might trigger procrastination. In a hypnotic state, these connections can be consciously addressed and reframed. Suggestions can be introduced that alter the perceived reward or consequence of a behavior, weakening the automatic link between the trigger and the old habit while strengthening the association with healthier, more adaptive responses. Over time, these rewired connections reduce the unconscious pull of old behaviors and make new habits more natural. Visualization and mental rehearsal are key components of using hypnosis for habit formation. Individuals can imagine themselves successfully performing desired behaviors, feeling confident and satisfied with the outcome. This repeated visualization not only reinforces neural circuits, but also primes the emotional and motivational systems of the brain, increasing the likelihood of translating the imagined behavior into real-world action. The integration of cognitive, emotional, and motivational components ensures that the new behavior is encoded in a robust, multidimensional way, which supports lasting change. Hypnosis can also enhance self-efficacy, which is a critical factor in behavior change. By entering a state of heightened focus and receptivity, individuals can internalize affirmations and suggestions that strengthen confidence, reduce self-doubt, and foster a sense of control over their actions. This improved self-belief supports consistent engagement with new behaviors, even when challenges or setbacks arise. Over time, these repeated experiences reinforce the brain's capacity for adaptive change, creating a feedback loop in which successful habit performance further strengthens motivation and confidence. Regular practice of hypnosis consolidates these changes, making behavioral transformations more resilient. By systematically applying hypnotic techniques to reinforce desired behaviors, individuals can effectively overwrite old patterns, establish new routines, and align their subconscious and conscious intentions. Over time, this results in consistent, long-term improvements in health, productivity, and personal growth. Creating a foundation for sustained hypnosis can significantly enhance physiological recovery and overall resilience by engaging both the nervous system and the mind in a coordinated process that supports repair, regeneration, and optimal function. When in a hypnotic state, the body shifts toward parasympathetic dominance, which is often referred to as the rest and digest mode. This state reduces sympathetic arousal associated with stress, lowers heart rate, decreases blood pressure, and promotes hormonal balance, creating ideal conditions for the body to focus energy on repair and recovery processes. By repeatedly activating this physiological state, individuals can improve their ability to recover from both physical exertion and mental fatigue, accelerating healing and restoring energy levels more efficiently. One of the primary mechanisms underlying this effect involves the nervous system's influence on tissue repair. During stress, the sympathetic nervous system prioritizes immediate action, diverting resources away from processes such as cellular regeneration, immune activity, and hormonal equilibrium. Hypnosis counteracts this by promoting relaxation and parasympathetic activation, allowing blood flow to tissues to increase, oxygen delivery to improve, and nutrients to reach areas in need of repair. Enhanced circulation during hypnotic states also facilitates the removal of metabolic waste products, reducing inflammation and supporting the body's natural healing mechanisms. This is particularly beneficial for athletes, individuals recovering from injury, or anyone engaged in high-demand physical activity. Hypnosis also interacts with the brain-body connection to influence recovery indirectly. Focused attention and guided visualization can modulate pain perception, reduce discomfort, and encourage adaptive responses to stressors. Mental rehearsal of optimal movement patterns or healing processes strengthens neural pathways associated with these outcomes, improving coordination, muscle recruitment, and overall physical performance. By training the brain to anticipate recovery and visualize repair, individuals can reinforce the neurological foundations of both physical and physiological health. Sleep is another critical component affected by hypnosis. Quality sleep is essential for tissue repair, hormonal regulation, and cognitive restoration. Hypnotic techniques that promote relaxation and reduce stress before bedtime enhance the ability to fall asleep quickly, maintain deep restorative sleep, and wake feeling refreshed. Improved sleep quality ensures that recovery processes occur efficiently, supporting long-term resilience and reducing the risk of chronic fatigue, metabolic disruption, and impaired immune function. By facilitating restorative sleep through focused attention and relaxation, hypnosis serves as a powerful tool for maintaining overall physiological balance. Immune function is also positively influenced by hypnotic practice. Parasympathetic activation and reduced stress hormone levels allow the immune system to operate more effectively, supporting the body's defenses against pathogens and enhancing recovery from illness or injury. Additionally, repeated practice of hypnosis strengthens the body's capacity for self-regulation, increasing resilience to environmental and psychological stressors over time. This integrated approach ensures that both mental and physical systems work together to maintain optimal health and performance. By consistently incorporating hypnosis into a routine, individuals train their nervous system and brain to enter states conducive to recovery, repair, and resilience. The combination of parasympathetic activation, focused attention, visualization, and enhanced neuroplasticity supports efficient healing, improved physical performance, and overall well-being. Over time, these effects accumulate, providing a foundation for sustained recovery, increased energy, and long-term improvements in mental and physical health. Hypnosis ultimately offers a holistic framework for optimizing recovery, as it coordinates the mind and body to promote repair, resilience, and adaptive functioning. By engaging both conscious focus and subconscious processes, individuals can enhance their capacity for restoration, accelerate healing, and support enduring physical and mental vitality, of behavior. When practiced consistently, hypnosis becomes a powerful tool for sustaining long-term health and resilience. By intentionally engaging the nervous system, enhancing circulation, supporting restorative sleep, and reinforcing adaptive neural pathways, it allows the body and mind to recover more efficiently from stress, exertion, and daily challenges. Over time, this creates a durable foundation for physical vitality, mental clarity, emotional stability, and overall well-being, enabling individuals to perform at their best while maintaining lasting health.